Yes
So,
po,
Yes,
Doc.
yes po, Doc. Yes po, Doc.
okay. So, if you will see, we are giving simultaneous lectures in several sections. So, to be fair with you, we are using one set of teaching slides, okay? And for each set, we have the module developer, okay? Like for this one, it's Dr. Nocheseda. For this topic, I will be the one for breastfeeding, okay? So that you are given the same set of teaching materials, okay? So for my lecture in ethics, okay, the unprecedented COVID-19 pandemic, okay, brought, of course, we all know this, drastic changes in our lives and affected the educational system, okay? So it continues to cause uncertainties and probably because of the emerging variants, okay? And the emerging infections compounding COVID-19 disease like the monkeypox, okay? And the long COVID-19 infection, okay? So while you have a separate subject on bioethics, okay? The department strongly felt that we must integrate the study of ethics in pediatric education and clinical training. Okay, so the hard hit, many, of course, almost all aspects are hit by the pandemic, but the hard hit, we have the healthcare system, which resulted to death. Okay, some of them I personally know, and some of them are my colleagues as well. Okay, some had burnout, and we also have lack of healthcare workers, especially nurses. Okay, hospitals are not filled up to the maximum, even if there are many beds, because there are only few nurses. Okay, so the number of admissions are based on the number of healthcare staff, not on the beds. And there came a point that there were also shortage of medical supplies, diagnostic tool kits for COVID-19. Remember early on, limited ang testing, plus the rising medical costs, okay? So medical education has shifted to remote teaching since the start of the pandemic. So the learning strategies and our delivery of alternative learning resources provide you with the needed competencies. Okay, we hope, okay? Even the methods of evaluation and assessment have been revised in most schools, okay? And this happened while you are adjusting to virtual learning. Although experts would say that these changes are mere adaptation and not really innovations, okay? Plus the experience in online examinations, not just at FEU, locally and in abroad, has been, beleaguered by cheating, okay? Then there are Zoom parties, there are Googling for answers, and there are desperate cheating techniques as well, okay? So it is therefore just right that we take off on the right footing by discussing the role of ethics in medical education and practice. So the type of learning that we offer you is flexible and that we will have face-to-face classes when feasible. But this type of learning allows you to learn at your own pace, okay? And develops in you the other mature way of learning, which is independent and self-directed. So the traditional methods, which was face-to-face, now it's now blended with synchronous and asynchronous activities, okay? And other alternative learning resources that are delivered virtually. So the school and the department shall continue to provide you with the resources needed to achieve the competencies, both cognitive knowledge and necessary skills in becoming primary care physicians. So we go now to ethics. Dr. Liz Grant of the Global Health Academy discussed the 7 virtues of healthcare professionals who are engaged in remote teaching and learning, okay, and also in practice later on. So first is truthfulness, okay? That's being honest, okay, in what we say and in what we do, okay? So I want to be honest with my colleagues. I want to be honest to you. I expect you to be honest to me. You should be honest with your group mates. So this is how it's going to happen. It should happen, okay? And particularly, most important in the end is us being honest with our patients and their families, okay? That is in managing the patient and in relating with the patients and their relatives, okay? Medical students and even doctors must never cheat during examinations, okay? We still have exams as well, specialty examination and that. And you should not falsify your work, okay, your work data when you go into clinical rotation in the hospital. Then the medical charts should not be tampered, okay? The monitoring sheets should be filled up honestly, okay? And we had cases of parents complaining of some medical students, clerks, who are falsifying the monitoring sheets. Okay, they would complain, hindi naman po nag-blood pressure monitoring. Pero nung lumabas po yung clerk, pagkita ko po, may BP po yung anak ko. And it happens probably midnight or early in the morning. Okay? So these are things that we want to prevent from happening. And we hope that this lecture will achieve that as well. Okay. The medical charts, everything inside the charts, these are legal documents. Okay. And these are part of the data that should be protected as stated in that Data Privacy Act. Okay. And cheating is a choice, okay? It's about one's character, okay? It's about the learner being upright in his pursuit of medical education and training, honor and integrity, and must always be upheld in the practice of medicine and all professions for that matter, okay? Because once you graduate, leave FEU, but you have that mark that you are a graduate of FEU. And when you go to training, we do some encounter problems from our graduates who will have some issues about being honest. Okay. And a simple act could taint your years of learning, of being truthful and honest. Okay, so try to avoid that. Trustworthiness, okay? Are you reliable? Diba? That's being trustworthy. Are you dependable? That's why we have individual work. We have group work, okay? In a group activity, do you participate? Diba? So that's one, okay. That's why we also have peer evaluation, okay? So that your peers can also inform us of how you perform. Most importantly, after graduation, can the patient trust you? Can the parents trust you? Okay? You have to earn that, okay? And the doctor-patient relationship, it's built on trust and respect. So all of us, not just you, but me as well, and my colleagues, all of us must always strive to be diligent and faithful in our chosen vocation. Insightfulness. This is applying evidence-based medicine, okay? And carefully expressing it with, if possible, with art and creativity. So the complexities of pediatric diseases, its management and prognosis, these are explained with what? With precision, with facts, okay? And since it's evidence-based, you only develop this virtue through reading and studying, okay? How will you know about evidence-based medicine? You have to read, you have to understand, you have to learn, okay? You have to study. Vulnerability, as it may seem, the question is, bakit siya naging virtue? Ne? Okay, it may not seem to be a virtue yet. It is considered to be central to our human experience and existence, okay? Because coming to terms with our own weaknesses and openness will help us to become better, identifying our weaknesses and working to improve it is something that we should aim for, okay? We should always try to work and be a better person. So we recognize our weaknesses and we do not disregard this. We recognize them and we do something about it. Respect is giving regard to the feelings of another person, okay? And that other person could be the patient, the parent of the patient, your professor, your classmate, or someone in the administration, okay? That's it. So respect is very important, of course, okay? And so even if you disagree with a policy or a decision or an outcome, you deal with this disagreement with respect, okay? So respect should be given even if the family of the patient is shouting or is cursing. This normally happens in hospital settings following the death of a patient, okay? Then we should be mindful that the respect should be still there, okay? We do not answer back, okay? We probably have to refer to a senior healthcare provider, to the attending physician. We refer to our residents, okay? And we have the customer service department in the hospital where these are discussed, okay? Where the people concerned are called to a meeting, okay? Compassion is something that should be inherent in you as a physician, okay? It is kindness. It is empathy to the patients, okay? They are sick. The parents are not able to work because of the child. They have other children to think about. They have other bills to pay. This is an out-of-pocket medical expense for them. My child is serious. You put this all together and their attitude will really be different. And we should be able to understand that, okay? So compassion among healthcare professionals, especially doctors, must be encouraged and embedded at this point in your life in the undergraduate medical education. And this goes on when you go into training, when you go into further education, and when you become part of the workforce, okay? Either as a healthcare as a healthcare a provider or as a teacher or as an administrator, okay? So personal values and virtues, this must be always be the core of our behavior, okay? Lastly is joyfulness, okay? Please find joy in learning medicine. Find joy in what you are doing, in your decisions, okay? In your choices, okay? We find joy in seeing our patients recover, okay? And medicine is a lifelong learning. So medical students and doctors should always find joy and purpose in learning new things. Learning makes us a better physician, okay? And that will be transmitted to better patient care. So this lecture hopes to inculcate the 7 virtues of medical professionalism, including the knowledge and practice of medicine, okay? That is in the highest ethical standards. So it's important for you to remember these virtues, especially this time of infodemic, in time of fake news circulating around, okay? In times of shortcuts and disregard of others' rights, okay? So now we proceed to the Convention on the Rights of the Children, okay? So these are ethical considerations in pediatric practice, okay? We look at the rights and always for the best interest of every child. So the Convention on the Rights of the Child is the most widely ratified human rights treaty in history, okay? And for the past 30 years, children's lives all over the world have changed for the better. Since 1990, there is a 50% reduction in the number of deaths or mortality in less than 5. The proportion of malnourished children was cut by 50%. And there are now 2.6 billion more people with clean drinking water. But still, there are millions left behind, and there are still children dying, children being undernourished, children without access to clean water. Okay? So the Convention on the Rights of the Child, it was also anchored on non-discrimination, child participation, survival, and development. Okay? So there are 54 articles, but the articles 43 to 54 are inputs from adults and governments. So just the first 42 articles are for the children, okay? So in the Philippines, the legal age is 18. Therefore, a child is less than 18. In other countries, it would be 16. In other organizations, it's 21, like in the National Institutes of Health. Those who will participate in clinical trials sponsored by the NIH must be 21 and above. If below 21, they are considered children, or meaning needing assent and informed consent of parents. So it differs in organizations and countries. So non-discrimination, all rights apply to all children without exception, okay? Adequate care are provided to the children by, of course, by the family, the parents, certain organizations, state parties, okay? And we always consider, of course, the best interests of the child. And these articles, these rules, these rights must be implemented, and there must be a body that sees to it that these are being implemented. Who should provide guidance to the child? Okay? Primarily the parents, of course. But in some cases, these are the grandparents or the uncles and aunties. Why? Due to death, due to health reasons, due to work. Okay? We have OFWs, we have parents working in the provinces or in another place, and somebody has to take care of the child. But the right to life should be provided with what? With the basic necessities, which are food, education, home, safety. Okay? So if every child has a right to life, okay, we give them a name, we give them a nationality, and therefore they have their own identity. So children live with their parents, of course, except in cases of proven child abuse and child neglect or child neglect, okay? So contact with either parents is not severed by separation of parents, okay? So that the child is not denied the other parent in case of separation. Family reunification is not a local issue, but we observe this in other countries, okay? Like in the borders of the United States, okay? You would say freedom from kidnapping. You would say, how do we, how, well, how do we say that? Why do we say that the parent kidnapped the child, okay? Now, there is kidnapping or abduction by a parent of a child if it is against the rights of the other parent, okay? Especially if taking the child to another country, okay? And we have freedom of opinion, okay? So you see, the child's opinion is taken into consideration and even in decision making. This is best exemplified by children participating in research, wherein we get their assent to participate if they are 7 years of age to less than 18. So we do not just get the parents' informed consent, but the child has to give assent as well in research participation, okay, for 7 years and above. So we respect their opinion, okay? Unless it's a sure thing that it's for their benefits. For example, vaccination, okay? We see them in the clinics, they're shouting, they're fighting, talk, okay? But we restrain them, okay? Because we know it's for the benefit of the child and it's the decision of the child, okay? We just get few patients, more than 7, who will still refuse vaccination. Freedom of expression. It's almost the same as the previous article, okay? Freedom of thought, okay? And these are subject to parental guidance, okay? Now, when it comes to freedom of association, this is best exemplified by our children going to school and interacting with their teachers and classmates, those attending extracurricular activities, other sports, okay? Those who are active in the community and religious organizations, okay? So protection of privacy, adults are not the only ones who should be protected from their privacy, but also children, okay? And they're also protected from libel or slander, especially now that there are a lot of cyber issues. Okay, so how do state, how does state assist parents? Okay, so the government provide what? Maternity and paternity leave from work, okay, when they give birth. We have benefits for single parents, okay, and children who cannot send their children to school or to private hospitals have the option to send them to public schools and government hospitals, okay? Freedom from abuse, okay? So we identify this. There has been a significant increase in cases of child abuse and neglect during the pandemic, okay? There have been many reports on that. And once identified, we have several government and private programs and institutions to care for them. Okay, we have the VAUSI, the Violence Against Women. Okay, this is in the hospitals. We have this is an RA 9262, Anti-Violence Against Women and Children. We have the Commission on Human Rights. We have the Women's and Children's Desk in the PNP. Okay, we have the NBI also. So these are the ones that would identify and pull out the children from the abusive caregivers. Okay, alternative care will be what? Your social services, the DSWD. Okay, where we have organizations and places for abandoned children and children for adoption, which is also the next article, safe adoption. Okay. So, what is safe adoption? Okay. Parents who want to adopt are screened. Okay. They undergo vigorous screening. Okay. And, there is this transition phase when they adopt, especially for toddlers and older children. Okay. A transition phase wherein the adoptive parents will spend weekends in the adoption place to slowly interact with the child before they transition the child to their home. And then once the papers have been processed, they have to report regularly. Okay. But they also get the same privilege as real parents. Once an adoption process is uh, finalized, the adoptive mother can file for a maternity leave. Okay, it's like she gave birth. Okay, they can apply for that and the other benefits. Okay, refugee protection is, well, not locally a problem. In other countries, yes, because this is an international rights for children. Special disability care. Okay, they have a right to special care, education, and training. We have SPED in certain public schools for children with with uh, developmental concerns. Okay, we have that. We provide that to them. Okay, and then the health services are your given to the children is that they have access to free medical care, usually in government hospitals. And for preventive health care, we have the National Immunization Program in the local centers where children up to 1 year of age avail of the vaccines against leading infectious diseases. Okay, review of placement. Okay, so if the child is placed by the state for reasons of care, protection, or treatment, then that placement is evaluated regularly. Okay, and that is also for the protection of the child. Okay, because are they getting uh, adequate care? Are the providers not abusive themselves? Okay, how are the systems, how are the standard operating procedures being practiced or violated? Okay, social security. Okay, with social insurance. Okay, more in other countries. Standard of living. So every child has the right to a standard of living that is adequate. Okay, that is appropriate. Okay, and that is allowing them to grow physically, mentally, spiritually, morally, and socially. Okay. Education has been mentioned earlier. Okay. They have the right to education, and we provide this until senior high school in government hospital, in public schools. Okay. And then when they go to college, there could be subsidies. Okay. We also have government colleges. So it's very important now for the next is personal development, which is they overlap. They overlap with other articles in providing the growth of the child as a whole. Okay. So we have minority communities and indigenous populations, and we have to respect their culture as well as at the same time providing them with the necessities of life, like clean water. You see, it's a right of the child, okay, to leisure, play, and participate in cultural and artistic activities. Okay, isn't it beautiful? Okay, we recognize their right of being a child. Okay, and then we have freedom from child labor. Okay, They have the right to be protected from work that threatens his or her health, okay, education, or development. So the state sets minimum ages for employment, okay? So you would ask, how about those in the commercials? These are children, okay? The parents have to get special permits from the Department of Labor and Employment, okay? They have to seek medical certification for the health of the child. And in that certificate issued by the Department of Labor and Employment, they also state several bases for protecting the child from abuse from work. Okay. So protection from drug abuse. Okay. So sometimes it's the parent or the caregiver. So we have to pull them out once identified, and they have to be protected. Okay. They should not be used to distribute drugs. Okay. Very important is freedom from sexual exploitation and from human trafficking and other forms of exploitation. Okay. So in some local reports, okay, some of the uh, perpetrators of abuse of children are imprisoned. Some are still ongoing trials, and a few were not charged. Okay. So we do have also cases of child on child sexual abuse, meaning to say, children are abused by children, by adolescents who are less than 18 years of age. Okay. So they should be protected from such. Freedom from torture. Okay. It's like, again, abuse. Okay. And then protection from conflict. So no child below 15 shall be recruited into the armed forces. Okay. No child below 15. Okay. Rehabilitative care. Okay. That the child victims of armed conflicts, torture, maltreatment, or exploitation receive appropriate treatment for their recovery and social reintegration. Okay. And then juvenile justice. They have the right to treatment that promotes the child's sense of dignity and worth, takes the child's age into account, and aims at his or her defense. Okay, so we look at the root. Why would they be delinquent? Okay, so it starts with neglect, and some will be their only means of survival. Okay, so we look at the root cause of poverty and education as well. Okay. Relevant higher national standards. And if a country has laws and standards that go further, meaning to say, if we have laws that further protect the children that are not stated here, then of course we must keep these laws, plus this Convention on the Rights of a Child. We should be knowledgeable of these rights. We should inform the children of their rights. Okay. And this is done in schools, in our everyday interaction with them. Okay. And the rest are for adults and other government institutions. Okay, so we have the remaining slides for ethics in pediatrics. Okay, so pediatric ethics is a branch of bioethics that analyzes moral aspects of decisions that are made relating to the health care of children. So we're talking here of critically ill children, children with chronic and conditions with high mortality or with no treatment available at that. So it is the study of rational process. How do we determine what is the best course of action in the face of conflicting choices? Some parents would say, I want my child to receive all possible treatments, even if brain dead reasons. So these are the concerns that we have to explain and make a decision of, okay? It is the very reason why we started our discussion earlier of the definition of a child and his or her rights, together with the state, parents, and professional obligations that are related all to healthcare. So, beneficent paternalism, okay? It's the notion of beneficence is broad. It occupies a central place in morality. So what does it mean? What does it mean to us? Okay, it refers to a normative statement of a moral obligation to act for the benefit of another person, helping them to further their important and legitimate interests, often by preventing or removing possible harms. In our case, the child. Okay, it is important to distinguish beneficence from benevolence. Whereas beneficence refers to the action or rules aimed at benefiting the child, benevolence refers to the morally valuable character trait or virtue of being disposed to act to benefit others. Okay? So we remember that children have very limited or no ability to decide for themselves, especially during medical situations and medical emergencies. Therefore, the pediatricians have an independent obligation to act in a child's best interest that takes moral precedence over the wishes of the child's parents. So it may be contradictory. Parents may refuse further treatment, but if we think that the chances of survival is high, being a physician, we have that moral obligation to intervene. So how do we approach ethical issues in pediatric practice? There is always a possibility of conflict that may arise among the child, the parent, and the clinician. And this happens during the different stages of healthcare delivery. There is an approach to the ethical issues that arise in pediatric practice that must include respect for parental responsibility and authority. Of course, we have to maintain that, but that must be balanced with the child's developing capacity and autonomy. A classic example is an adolescent with cancer, terminal cancer, refusing further treatment as against the parent's decision, and you as a physician who knows that there are no current treatments that is shown to be effective, okay, so the parents would decide against the will of the adolescent terminally ill patient. So this is compounded by complexities arising from heterogeneity of social, cultural, and religious views about the role of children. So that's why we have informed consent and decision making. So informed consent comes from the parent or the legally authorized representative. Okay? And it involves the ability to understand and communicate, to reason and deliberate, and to analyze conflicting elements of a decision using a set of personal values. So this informed consent is made by parents of children less than 18 years of age. While parental permission, rather than consent, reflects a surrogate or proxy decision made by a parent on behalf of a child, okay? Constrained both by the child's best interest and the independent obligation of the clinician to act in the child's best interest, even if this places them in conflict with a parent, okay? So usually this is not just decided by the attending physician, the parent, and the child. Usually this is brought to the ethics committee of the hospital. And the ethics committee members would include a social worker, a healthcare provider in the field of the disease of the child. Okay, we have the guardian. Okay, so it's a group of individuals who will help the parent decide, considering the best interest of the child. That's why we have assent and dissent. Okay, so a child's affirmative agreement, that is assent, should be solicited, and a child's disagreement is documented as dissent. Remember that if the child does not solicit assent, it doesn't mean that they approve of it or that they disagree with it. Okay, it must be an agreement that they agree or disagree. Okay, and although dissent, it's morally relevant and it must be honored but it must be honored. So respect for children's clinicians and parents may override a child's dissent when the intervention is essential to the child's welfare, like vaccination. Okay? So we balance the benefits, burdens, and harms of therapy. We strategize on how to convince them regarding immunization or how to explain them that such information is false. Okay? We should understand and respect the religious and cultural differences that, of course, impact their decisions. So we have here discharge against medical advice. You will hear of that when you go into your clerkship and training, okay? Meaning to say, you offer the treatment, but they go against it, okay? Especially if the treatment is something that is invasive, that you would need consent. And we do encounter cases wherein they sign the consent for being discharged against medical advice. So in that, we explain the consequences of their decision. Okay? That if you decide so, these are the possible consequences. It must be made clear to them. So the dramatic physical and emotional changes that occur during adolescence and the concept of evolving autonomy as young teens begin to develop such that the capacity to participate fully in decision-making for their care must be respected. So this is observed in older children, in adolescents, okay? The relationship of an adolescent patient with his parents, okay? These are sensitive ethical concerns, okay, that must always be considered. Focus is directed on empowering adolescents to take responsibility for their health and their health care. Okay? So there is an analytic approaches. There are analytic approaches on ethical concerns with bioethics committee. Healthy clinicians and parents make hard choices for their critically ill and dying newborns. The principle of best interests should be examined and its utility and limitations discussed. Okay, the newborn has multiple congenital anomalies, represent the survival rate. Okay, the child has congenital leukemia, represent the available treatment, the side effects of the treatment, and the survival despite treatment. Okay, these are the issues that parents may not understand and are relevant for them to make an informed decision. So neonatal ethics, there is continuing change in the limits of viability of extremely premature infants, okay? So there are more infants who are premature and are surviving. Okay. On the other hand, these premature infants who survived during the neonatal period may have consequent developmental problems later on. Okay. So if providing a treatment would merely prolong dying and would not be effective in ameliorating or correcting the life-threatening conditions, or it would be futile in terms of the infant survival. Okay, so we decide, okay, we can withhold or withdraw treatment. So we balance the benefits, burdens, and harms of therapy in the face of uncertainty of the outcome. Okay, so some critically ill patients will be given drugs uh, if they will be enrolled in clinical trials or upon request by explaining to them that so far there is no proof of the benefits. Okay, so those things happen, especially during the COVID-19 pandemic when there were no yet drugs being approved for COVID treatment. Okay. Yeah. Okay, so that's it. We do in some government hospitals, there are chronic patients hospitalized, intubated, with multiple congenital anomalies. Okay, so these are brought to bioethics, okay? Because you are just hanging on to it when you know that the outcome may not be going to be productive for the infant or the child, okay? So educating the parents is also important. But we have to be honest with what we say, okay? So for the critically ill, we define limits of therapy based on assessments of medical futility. We recognize the moral equivalence of not starting an ineffective treatment and stopping, okay, an ineffective treatment. Controversies such as withholding medically administered nutrition and hydration is another concern. Some would not be aggressive as to no more intubation, no more blood transfusion, but they will not withhold parenteral nutrition and hydration. Okay. So as pediatricians, we must explore the role that children can play in planning their own care, especially as they grow older. The concept of brain death is examined and should be contrasted with cardiac death. Okay. There are ethical justifications for organ donation after cardiac death may be discussed. Okay. Other organ donors are those dying of vehicular accident. Okay. So this is one ethical issue as well. Okay. And life-sustaining medical treatment, or LMST. So justified when the anticipated benefit outweighs the burdens to the patient. I'm sorry, I cannot read that clearly. Okay. It's justified when the availability of technology does not in and in itself obligate its use, and decisions to use, limit, or withdraw should be made after careful consideration of many factors. Okay? Medical futility is impossibility of achieving a desired physiologic outcome. So if it's medically futile, okay, should we initiate? Should we continue? Should we discontinue? Okay. And what is new now is the palliative care, especially in pediatrics. This is something new. Okay. Training is not locally available. You have to undergo training also abroad. Okay. This is when interventions focus on the relief of symptoms among terminally ill patients. Those who will prefer to be discharged from the hospital and be brought home for the remaining days. Okay. And there is also the what we call advanced directives, mechanism that allows patients and or appropriate surrogates to designate the desired medical interventions under applicable circumstances. So what are the advanced directives? Do not resuscitate if goes into hypotension. Okay? But usually among adults give this directive. But for children, it could be the parent. Because sometimes what will happen is that the patient will deteriorate in the hospital at the time that the parents were not around. And di ba, what decision will you make? The parents are not there. Okay? So some will give advanced directives. So even adults can do that. Adult patients can make advanced directives, okay? But that's again another ethical issue. What if the parent, if the patient himself gave an advanced directives, okay? This is an actual scenario during the COVID-19 pandemic. The father made an advanced directive that if with severe COVID-19, DNR, do not resuscitate. But when the patient became severe and the level of consciousness changed, the adult child does not want the advanced directive of the father to be implemented, and they want interventions to be done. So these are ethical issues that need to be discussed with the legal department as well. So we have the brain death, okay, and there is irreversible cessation of all functions of the brain, and determined by clinical assessment and other ancillary tests. Okay. So if there is brain death, what is the decision? And there are observation periods. It's very important to determine the presence of it. Okay. So there must be two different physicians separated by an observation period. Okay. So one determines that the child has met the criteria for brain death, and the second confirms it. Okay. It must not be just a diagnosis by one physician. And there must be documentation, okay? Documentation of diagnosis of brain death, okay? What is the etiology and status, okay? Absence of confounding factors leading to coma like hypothermia, hypotension, okay? Because there could be intervention here, okay? And it might change, okay? So there must be proper documentation. And then supportive care for the remaining hours and days as the family make decisions about potential organ donation and comes to term with the diagnosis. Okay. Some would be offered autopsy for undetermined causes of death. Okay. And what is the doctrine of double effect? So an action with both good and bad effects. Okay, it's morally justifiable if the good effect is the only one intended, and the bad effect is foreseen and accepted but not desired. Okay, so this is applied in end of life cases. Like for example, you increase the drug for pain, okay, but it would result to respiratory depression, okay, or apnea. So what do you weigh there? The severe pain that the patient is feeling and the discomfort against the relief of pain and the risk of bradypnea and apnea. Yeah. Usually, the main concern there is the severe pain. Okay? So there are many issues in pediatric ethics. Okay, we will not discuss this anymore. Okay, in all aspects there are ethical issues. Okay, and some have no uh, guidance yet on how to deal with it. Okay, so we do have conferences. If it's ethical issue, then usually it's interdisciplinary. And there are really a lot of discussions going on in such a case, like choosing a different physician. The chosen physician is not around at the time the patient became toxic, and another patient doctor decide, so a lot of issues, and some are just, wow, this was not mentioned in how to go about such an ethical issue. Okay, so there is the Pediatric Ethics Committee and Consultation, wherein we present the case and they draft the decision and the recommendations, getting all sides of the group sharing their thoughts and their decisions. So each hospital must have an ethics committee, okay, for the discussion and resolution of ethical issues that is raised by the parent or the caregiver. So access to ethics consultation should be open to patients, families, staff, and members of the medical team. Okay? Information about the availability and process of ethics consultation should be widely distributed to patients, parents, family members, nurses, and everyone in the team. Okay? So let me end by these quotes, okay? One is by Albert Schweitzer. A man is ethical only when life is sacred to him. Okay, so that's respect for life, respect for others. And another one from a Russian novelist and historian, even the most rational approach to ethics is defenseless if there isn't the will to do what is right. Okay, so those are the important words about ethics. It's about life, about what is right. Educating the mind without educating the heart is no education at all. At all. Empathy. The most important human endeavor is the striving for morality in our actions. Okay? Even if no one sees, even if no one will recognize, okay, our inner balance and even our very existence depends on it. Okay? Only morality in our actions can give beauty and dignity to life. Okay? I think that will be all. And these are the references. Okay. So that will be all. So much